Hi, I'm Ayako Miyashita Ochoa, Associate Director for the Southern California HIV/AIDS Policy Research Center. We are located at UCLA Luskin School of Public Affairs. I'm joined today by my good friend and colleague, Marco Castro-Bojorquez, filmmaker, HIV human rights activist, and the co-chair of the HIV Racial Justice Now organization, a coalition of people of color who are movement leaders in the mission to end HIV, but really to do so using a racial justice framework. Thank you, Marco, for joining us.
It's a pleasure to be here with you, Ayako, always.
Well, as somebody who really helped us start out the process of looking at HIV criminalization laws here in California, I was hoping you could give us some information today about your experiences and your work on Senate Bill 239, which was the bill to modernize HIV criminalization laws in California.
It all started at the HIV Is Not a Crime conference in Iowa, in Grinnell, Iowa, where I met you there actually, and I came back from that conference with the intention and the decision in my head that I was going to be involved directly to abolish or to modernize the laws that criminalize people living with HIV in California. As a person living with HIV, I know what it is to deal with that condition, and on top of that, all of the structural barriers that exist for us to actually live our lives. And I always would tell myself that what we needed was not for us to be sent to jail, but rather to be sent to a hospital or to a doctor. That's what we needed. The decision to be part of this effort had a lot to do with my life and with the fact that I'm somebody who's living with HIV, and with the fact that I believe that that the people that live with HIV, what they deserve is the respect and the care of the society, rather than the criminalization that it ends. It results of actually a lot more stigma and a lot more misinformation and hatred against us. So I'm very, very proud of the work that we did.
Thank you. Thank you for sharing that. I think it's really important to remember that these issues like HIV criminalization impact people in so many ways. One of the things that I think drove us to do research on the topic was a desire to know exactly who was being impacted by these laws. So I was curious to know, sort of from your perspective, how the research on HIV criminalization here in the state of California made a difference or had a measurable impact in how we pushed for change here in California.
Yeah. Well, thanks to you and many people that work with you, research was at the table from the very beginning. I think that, in my opinion, that the arguments, not only in the court, but also with the society in general, it stemmed out of science-based knowledge, right? And so I think that the fact that we were so lucky and privileged to have researchers like yourself that were working like insanely, it was actually, in my opinion, and I still can read pieces of media where the findings that you all provided us really help us to open the door for us to feel that we had a chance. And the people that are the most affected are those who are in the marginalized communities, like people of color, the transgender community is heavily impacted by this issue everywhere. And it's thanks to the research that we also knew that a lot of the folks that were affected, that were convicted, were also immigrant people. The systems of oppression that we have created specifically to oppress certain communities, were working very well in the criminalization of people living with HIV. And they're still, not only here in the US, but in the rest of the country, the rest of the world. Marginalized communities are the most affected by everything on regards to HIV, and criminalization is something that we don't need, that it should not be part of our struggle.
I do want to say that it's not just that the movement benefited from having researchers at the table. Researchers are benefiting from having movement leaders in their circles as well. So I want to express my appreciation for that.
And actually, specifically the transgender community keeps being very vocal at demanding that more data exist, because I think that it's also important for us to recognize that those folks, the transgender community, have always been in the front of the struggle of LGBT people and people living with HIV. And the least that they should be getting from us and from everybody to that is actually the recognition, but not the recognition in the shape or in the form of rights, of privilege, of equal. We cannot leave people behind as we have done with the transgender community. And I also think that from all the folks that I work with, the transgender community, transgender women, especially transgender women of color, are those who really struggle the most with issues like criminalization.
One of the areas where we collected data on HIV criminalization was with regard to the impact on immigrant communities. And so I know you and I have talked briefly about this, but to what extent having such data that tell us about the impact of HIV criminalization on immigrant communities, what difference did that make for you in your work?
Yeah. Well, first of all, it reaffirmed my conviction to fight for the rights of undocumented people. Especially, I adopted in a more serious way the human rights principles, and I utilize that framework now to all of the work that I do, because I was working for a civil rights organization at the time, and I realized that my work wasn't really affecting positively to the communities that I was the most worried and concerned. And so I think that it also gave me an opportunity to actually work in Mexico and go all the way to the Supreme Court in Mexico, bringing and supporting for us to actually decriminalize HIV in the state of Veracruz. We are still constantly having to reassure ourselves with folks that don't understand that we are advocates, that we are that we're persistent advocates, and HIV criminalization is one of the areas of the HIV movement that requires for us to have that type of, I call it wood. In my country, we say that backbone, right? That is so important, that we are not going to be intimidated by people in power, because we know what is good for us. We know what is best for us, and I think that has created. I think that has been instrumental for where we are right now in the HIV struggle, where we biomedically we have the tools to stop the virus. Now we need to take down all of the structural barriers, like the criminalization of people living with HIV, so we can actually achieve to end the epidemic.